Hello everyone. Today we'll talk something about ventricular arrhythmia. They have three parts: ventricular premature beats, ventricular tachycardia, ventricular flutter and fibrillation. Ventricular premature beat. We have talked something about atrial premature beat. Ventricular premature beat is different from the atrial premature beat. We can see the ECG, the ventricular premature beat may be usually only the QRS complex. The QRS wave is upside, up direction, and the T wave is down direction. If the QRS is down direction, the T wave is upper side. They have different directions. This one is very typical. For the 2 RR interval between 2 RR interval normal QRS, the interval is similar with this one. These three normal QRS. This one is normal QRS, ventricular premature beat, and normal QRS. The interval between these two QRS with ventricular premature beat is just similar with these three. Ventricular premature beat is maybe the uniform or multiform, and they have the single shape, or maybe they have different shape. We call them uniform or multiform. Multiform ventricular premature beat have different shapes. This patient may be severe than the uniform. We can this one. This type 1, this type B. They have different shapes. Bigermany and trigermany. This one is bigermany. We have studied bigermany of atrial premature beat. This is 2 normal and abnormal. They repeat it 3 times. We call trigermany. Ventricular premature beat is have a very severe phenomenon. We call them R on T phenomenon. We see this ECG. The normal QRS, the T wave, the ventricular premature beat just on the T waves. This phenomenon can cause VT, ventricular tachycardia, and this phenomenon can cause ventricular fibrillation or flutter. We see this phenomenon, we must tell the patient you are severe cases. Ventricular premature beat maybe has between the 2 normal QRS. The rate of the normal sinus rate, you can see this one, and this one, didn't change anything. The ventricular premature beat is between 2 normal rate, just like this, and this one, and this one, and this one. We call them interpolated premature beat. The second part, we will see the ventricular tachycardia. It means 3 or more than 3 ventricular beats occurring continuously. Something repeats 3 times. We call them a rhythm. 3 or more than 3 ventricular per metric beat occurring continuously. We call them tachycardia. It's classified by the duration. If more than 30 seconds, we call them sustained. If the ventricular cardia is shorter than 30 seconds, we call them non-sustained. They also can be classified by the shape, monophology or polyphology. You can see this paragraph. This is ventricular tachycardia. We also see something flutter and fibrillation. This one is flutter. The shape just like sine, cosine waves, sine, cosine curves. This we call them flutter. For these conditions, the patient catch ventricular flutter or maybe fibrillation. It's regular waves. The heartbeat cannot put any blood out of the heart. The patient maybe catch unconsciousness, syncope. For this kind of patient, it's very, very, very severe. We must do the DC cardioversion immediately. We see some ECGs. Can you recognize them? This one is per metric beat, ventricular per metric beat. This one is by Germany. This one is multi-shape. This one is repetitive. We see ventricular per metric beat. They catch 2 ventricular per metric beat. If them 3, like this one, the next ECG, we call them VT, ventricular tachycardia. For the last one is R on T phenomenon. This one we must treat them immediately. This one, for some patient, we can see the patient catch a ventricular flutter that rapidly converts to the fibrillation. The patient will unconsciousness. How can we treat ventricular arrhythmia? Usually to treat the original diseases, including some risk factors. For the acute myocardial infarction, they may catch very severe condition of ventricular arrhythmia. For revascularization is very important for acute myocardial infarction. For medications, we usually use with no heart original diseases, we usually use lidocaine for intravenous use. Sometimes we take oral drugs, usually with sotalol or propranol. For if above drugs is no effect, we usually use amiodarone in intravenous. For some verapamil sensitive VT, it's very special type of VT. The only effective drugs is verapamil. For some patient with hypotension, shock, very low blood pressure, maybe have chronic heart failure, angina pectoris, we usually do DC cardioversion immediately. For this patient survived from the sudden cardiac death, we usually do some ICD, implantable cardioversion device. In 1980 years, the Miroski, this person is a very famous doctor. He planted the first ICD into patient in 1980. We also can do some RFCA, such as verapamil sensitive VT. The ablation is very effective. For some premature beat or ventricular tachycardia, we can do ablation. For some special heart diseases, we can do some surgery, such as HCM, hypercardiomyopathy. Thank you.